The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we're taking a look at children's health challenges from a different perspective, one that includes critical thinking and one that's not afraid to give you the honest truth. I've got one of the world's best critical thinkers joining us today. Dr. Peter McCullough is here, giving up time on your Saturday. Thank you so much.
It's great to be here.
We were just together speaking at the AAPS conference, and then right before the show, you were telling me how you've been on a whirlwind tour all over, back to Washington, D.C., the White House, etc. We'll get an update on that. Today's episode, we're going to focus on children's vaccines, the whole schedule and what's been going on with regards to that. Let me just say, if there's viewers who don't know Dr. Peter McCullough, he's an internist, cardiologist, epidemiologist. He's published over 1,000 articles, reviewed thousands. You're a world expert on COVID. You established the first life-saving protocol for SARS-CoV treatment, and you've continued to be very involved with that. So thank you for all that work. You've got a new book out, Vaccines, Mythology, Ideology, and Reality. I have read it. I love it. It's a real powerful addition to both the history of vaccines, and then I love the ending too, where you really delve into sort of the what happened with COVID. You understand that better than most. I would say, I'm just going to put it out there, if there's Christians out there and you've heard the WWJD, what would Jesus do? I'm telling you, I know this man, Dr. McCullough. We've been together so many times. For physicians and for medicine, it's WWPMD. What would Peter McCullough do? You are my go-to expert because you're so incredibly thorough when you review things. So we're diving into the childhood vaccine schedule, and that wasn't in your wheelhouse probably 10 years ago.
No, it certainly wasn't. And I really had no idea at how it had mounted over time, that more and more vaccines were added to the schedule. And, you know, as I go back and look at medical school, there really weren't any lectures on vaccination or even the childhood schedule, and certainly no lectures or continuing medical education on vaccine side effects. And Paul, that's true today. I searched PriMed, which is a big primary care series. I can't find a single continuing medical education lecture on vaccine side effects at all in all of PriMed.
Yeah. Isn't that crazy? I remember when I was in medical school, I think we're roughly the same era. The WWMR, that CDC document, I thought they were doing a good job with infectious diseases. And so we would read that a lot and really that was how we got our information. But you're absolutely right. We never got any information on what was in the vaccines or vaccine side effects. It was always just, they would share the benefit side of things. So do you have kids?
I do. My son is 28. My daughter's 30. No grandchildren. But my wife and I talk about this frequently, Paul, that, when that time comes, and, hopefully it will, we're going to have some discussions now about childhood vaccine safety. I think every young parent and, their spouse should carefully review this even before children, to have an understanding about why are there so many hearings on Capitol Hill now? Why are there so many tweets on Twitter? It's because the nation has become incredibly concerned with vaccine safety.
Right. So share your own journey, because I think I vaccinated my children. I mean, I thought that was the right thing to do. And then along my career as a pediatrician and seeing a lot of kids not doing well, and it appeared there was a connection, but the research has really evolved in the last 10 years. But explain your journey, because you went from, I don't think, even thinking about it, and now you've given it a lot of thought. What parents are in that same process. So take them along the journey of how you kind of woke up to, hey, maybe we need to take a serious look at this.
Sure. And I outline this in my book. John Leake was gracious enough to let me, make my little entry. But my family's originally from Ireland, and there was tremendous fear of infectious disease. In fact, my great-grandmother died of Bright's disease, which is post-streptococcal glomerulonephritis. She died at age 32 and left 10 children, if that can give you any idea of how impactful infectious diseases were. My grandfather died of post-streptococcal rheumatic heart disease. Wow. I never had a chance to get to know him. So you can imagine my parents being so fearful of infectious disease. You know, I was promptly taken in and vaccinated like my brothers. We were vaccinated for everything, double vaccinated for polio, initially the oral polio vaccine, then the injectable polio. I was born at the period of time where we received the single measles vaccine. I had mumps, I had chickenpox, and later on, I remember in elementary school, vaccinated for rubella. And so I never had any vaccine side effects. And back then, I didn't know anybody else who had vaccine side effects. We didn't have any children in my school with autism or epilepsy or tics or allergic diseases. We ate peanuts and peanut butter jelly sandwiches.
Yes.
We didn't have any food allergies. Life seemed simple when it was about 5 different diseases that we're being vaccinated for, and never questioned it. But of interest, when I went to medical school, I had my measles antibody titers checked. I was 21 years old. They said, you don't have any immunity to measles. Take another measles shot. So, I did. And then when I was a fellow, again, there was a sweep about measles. And so I had my, serology checked again, still no immunity.
You were a non-responder.
Yeah. So I was given the MMR vaccine twice at age 28. Now, I already had mumps. I was already vaccinated for rubella. Obviously, I'm a man, so I can't get congenital rubella syndrome. And now I had been vaccinated 4 times for measles. So wow. Later on in my career, I reviewed a paper by Bianchi and colleagues from Italy. And it was about Italian students, matriculated in medical school. They found fully 20% of measles vaccinated medical school entrants did not have any immunity against measles. Turns out, I believe the number was 94%. If they had measles naturally, they still had enduring measles serology. So that was just a little kind of wake up that, wait a minute, maybe these vaccines aren't holding. I went through the same thing through hepatitis B. I took the vaccines as an adult, never really displayed any significant immunity to it. So I took more boosters. I traveled, I was vaccinated for typhoid and other illnesses. And so I think in total, and because flu shots were given every year, and I never really wanted to take one because I've never even been tested for flu or had anything like flu. But, over the last 10 years, Paul, we were effectively forced to take it, to be on medical staff. When I count up 40 flu shots and everything else, Paul, I have taken 69 vaccines in my body.
Wow. So, you took most of those as a young adult or as an adult, which...
That's it. Yeah.
Right. And so that it's certainly my understanding of it all is that it's a lot safer if you hold off. I mean, when you hammer an infant with, what are we up to, like 40 doses by age 2 or something like that? It's not, in my opinion, I'd be interested in your thoughts on this. It's not the antigens that are the problem. I mean, I think our immune systems probably could handle that number of antigens. It's everything else that's in the vaccines. It's, the aluminum, the toxins, although immune activation that young is probably a big problem.
Yeah. I'm not so sure, Paul. We have reviewed the literature carefully at McCullough Foundation, and we found, hundreds and hundreds of papers to review. I think the way I put this together is that it is inflammation, particularly cytokines, which are stimulated by the vaccines. And that's both the antigens and the adjuvants in vaccines. And the cytokines really do rage quickly after, multiple vaccines in a child. The cytokines readily go into the brain. In fact, one of them stimulates a fever. So obviously the cytokines are going into the brain. And then, the cytokines do inflict damage in the brain. Mm-hmm. And I think it's far more than just an adjuvant toxicity issue. I know there's been great concerns regarding mercury. Ironically, the last flu shot I took in 2021 was one of the mercury-containing flu shots. It was like, oh, thanks a lot. It's like a parting gift in my new journey. And mercury is largely out of the vaccines now, but there still is aluminum, and the aluminum dosing far exceeds the body's natural excretion of aluminum. So that's a concern. But I'm very familiar with aluminum cerebral toxicity because as a cardiologist, I'm old enough to remember dialysis patients getting aluminum in the form of alucaps, a phosphate binder, and they developed an aluminum toxicity. It looks very different than autism. It really does. Right. Aluminum CNS toxicity, it looks far more like a dementia. To be honest with you, I'm far more concerned about aluminum and Alzheimer's disease and dementia than I am about aluminum in childhood vaccines. And the reason why I say that is there is a study in France, a longitudinal study, 9 years of data relating the aluminum concentration in water in France. It's called the Packwood study, to significant risk of Alzheimer's and dementia.
Yeah.
So if you just look at those data, you'd conclude no child should be receiving injectable aluminum. Why take any risks there at all?
Yes.
And in our book, we point out that the 1986 Vaccine Injury Compensation Act was a real inflection point there, where the vaccine companies, were granted immunity from liability. And it's interesting that liberal justice of the Supreme Court, Sotomayor, in her dissenting opinion to that ruling, said that this 1986 Vaccine Injury Compensation Act and removal of liability on the companies will have no incentive to improve safer vaccines. They won't have any incentive to get the aluminum mercury out or to study safety at all. And I've made the point, I was just on Capitol Hill, I made the point to several audiences that, listen, as a doctor, the drugs I use now are not the same drugs I used many years ago, because the drugs have gotten better and safer, particularly the anticoagulants, as an example.
Good point. I want to hear updates on, you've been very involved with everything that's happening around the ACIP and what's going on with children's vaccines. But before we do that, I'd be really interested in your take on this whole issue of, are the vaccines just associated with health problems, or are they causing the health problems? And how do we go from an association to, in medicine? I mean, we know that if you take penicillin and you have an anaphylactic reaction or hives, it's cause and effect. How do we go from, okay, initially we've got case reports and a possible association, to have we reached the point now where we can say causation is really on the table here?
Well, let's just take the issue of autism spectrum disorder. That's now 1 in every 31 children as of 2022. It's probably much more frequent now in 2025. And I'm referring to the CDC 16 Center Autism Network analysis. So that means basically 1 in 31, 3.2% of the pediatric population. Of that population, 27%, Paul, have profound autism.
Yeah.
And you've seen these children. I have some in my adult practice now. Their lifetime cannot communicate, repetitive head banging, injurious behavior, unable to toilet, profound decreases in mental capacity. This is an existential crisis. Yeah. In California, more than 1% of children like that. They need at least 1 or 2% of the population just to take care of them. And, I can tell you our CDC, and I've read all the reports, our CDC that we pay for, Paul, over 12,000 employees, nearly a $10 billion budget, and they're showing no concern over the autism epidemic. None.
Yeah, it makes no sense. This should be a 911, all hands on deck, figure this out.
Yeah, let's get to your question, though, about this. In our review of the literature, we think we found the first case of autism long before the vaccines. So it's a clinical diagnosis. Clearly, there's a lot of nuance there. It would be susceptible to, enhanced screening and detection methods. And there's 4 major components to autism diagnosis. Just like with heart disease, there's no single cause of coronary heart disease. People want to say, well, it's just this. And in cardiology, what we've done from the very beginning, starting with the Framingham Heart Study, is that we use the term risk factors. And I think with autism, it's a much better discussion to use the term risk factors. So what do we know about this in the published studies? Well, older parents, woman over 35, man over 40, that's a risk factor. Premature delivery before age 37 weeks, that's a risk factor. There are some common genetic variants that are associated, so they could be considered risk factors. And then I have to tell you, I think the big one, Paul, as a risk factor is combination vaccination. And when we look at the mounting literature, hundreds of studies now, it's clear that probably in someone who may have a predisposition, that the vaccines do act as this trigger. And when you apply the Sir Austin Bradford Hill tenets of causality, the temporal association, the children are born normal, but then there's this prompt onset of autism. Many times it's shortly after a big bundle of vaccines. It has a tight pathophysiologic relationship to the cytokines. In the vaccine manufacturers' package inserts, they don't say the vaccines cause autism, but they say something close. Almost all of them say that there is a risk of encephalitis, Paul.
Or
inflammation.
Yeah,
inflammation of the brain, almost as if autism is a post-encephalitic manifestation. But to go through the criteria, so we have the temporal association, the biologic plausibility, which is there, and we would include in there aluminum and the previously administered mercury, which are known CNS toxins. We would say that, is it internally consistent? Well, the internal consistency, I think, is the strongest of the arguments. And in our book, we highlight the case of Hannah Poling, the 19-month-old child of Jonathan Poling. He's a neurologist at Johns Hopkins. His case report clearly indicates the vaccines did trigger autism in her case. She may have had a predisposing condition, but it's clear. And in fact, the Vaccine Injury Compensation Act court agreed with him in 2008, Paul. And, they gave him a special compensation for him and his child, and then they wiped out the other 5,000 cases. So internal consistency is strong. External consistency. Do we see this across multiple studies? Yes. In fact, we're up to 13 studies, including your seminal paper, that unvaccinated children are just far healthier and a much lower risk of autism spectrum disorder than their fully vaccinated counterparts. And then we get to cohesiveness. Is it cohesive? And the answer is, it sure is cohesive. And in fact, the studies that have declared no association with vaccination and autism, every single one of them have been debunked now.
Yeah. Thank you for that summary. That is really, really powerful. That's my assessment. I was recently at a conference where it was all on genetics. This was Medical Academy of Pediatric Special Needs. I asked the panel on the final day, happened to be sitting on the panel, they were doing one on vaccines. And I said I'm not an expert on genetics. So I said to this group of, experts, if we did comprehensive genetic testing on every child born in America, what percentage would not have any risk factors for vaccine injury or mitochondrial dysfunction risk factors that would then put them at risk for for vaccine injury?
Right.
And they across the board said, everyone has risk factors.
Oh, really?
Everyone has risk factors. Obviously, some are much more impactful, and there's certain risk factors now they're going, oh boy, if you see this, please don't vaccinate. You're almost guaranteeing autism.
I thought you were
loads the gun, right? And then the vaccine in this case pulls the trigger.
That's it. Yeah, I thought you were going to say about 25% common variants or up to 50%, but you're right. As genetics becomes, has greater depth and breadth, we start to find these polymorphisms. And there's another little hidden piece here, Paul, is, parents are having children at an older age. My kids are going to be in that category.
Right.
And they are prone to premature delivery. But one of the biggest risk factors for having a preemie baby is for the mother to have a fever. And a leading cause of a mother having a fever, a normal woman who's taking care of herself, is to actually take vaccines herself during pregnancy, provoke a fever,
Right.
and then have that cause precipitous delivery. And again, that's in the package insert. Paul, that's in the package insert for the RSV vaccine that's given in the 3rd trimester of pregnancy. It's telling the mother right there, you could have a premature baby. So the premature baby itself is a risk for autism. There's other problems like intraventricular hemorrhage, intracranial hemorrhage, problems with brain development as a manifestation of prematurity. And now, Paul, there's a recent randomized trial published in JAMA where you have premature babies in the hospital, and they were randomized to either getting the vaccine schedule in the hospital or just delaying until they, grow a bit and out of the hospital. And those who actually got the vaccine schedule in the hospital, they had higher rates of apnea. They stopped breathing, and where the nurses had to revive them, Paul.
Yep.
So you can imagine
kids at home. That's SIDS. You lost your baby.
That's it. You've lost your baby. So that trial was very important, improving the proof of concept that a big bundle of vaccines, in fact, could cause apnea if the parents aren't there at home or that night. The child could stop breathing, and that's cohesive with the data from Dr. Miller, who has shown now that the vast majority of sudden infant deaths occur just a few days after a big battery of shots.
Yep. It's temporally correlated almost always. I don't know of any SIDS in unvaccinated kids or SIDS happening right before a well visit where vaccines are given. It's always happening after the vaccines. But I want to just highlight what you said about pregnancy. If you are pregnant and you're listening to this show, or you're going to be pregnant, it makes, to me, and it sounds like Dr. McCullough, you feel similarly, it makes no sense to intentionally aggravate the immune system of a pregnant woman, because we know that's associated with harm in the infants, neurological harm, autism spectrum, you name it. We know that from infections. I mean, if a mom is pregnant and she gets rubella or any infection, there's increased risk. Now it's multiple times. They're recommending multiple vaccines during pregnancy. Why would you intentionally do that during this very special, vulnerable time? It makes no sense to me.
And Paul, why is it new? Now, I bet your wife didn't take any vaccines during pregnancy. Mine didn't either.
Nope.
They delivered in the modern era of obstetrics. Why in around 2000, 2003 did vaccines, things for, diphtheria and tetanus and acellular pertussis and influenza, why did they start giving them to pregnant women? There was no need in the decades before for this.
No, and the science that they used to justify it, to my view, was pretty sloppy. It didn't make sense.
Well, they used, in some cases, a global justification for a U.S. vaccine strategy. And the example there is tetanus. Now, in the book by Barkey and Gear, it's called Avoidable Harm. It's a review of the vaccines. It's a very good book, Paul. They review this issue, and it turns out, like in the entire history, U.S. history of modern obstetrics, there have been maybe 4 cases of neonatal tetanus. I think, as I recall, 4. Whereas the CDC's publication on neonatal tetanus largely comes from Africa. Right. And I recently went on a safari in Africa, so I got some real first-time insight of why neonatal tetanus would be a big deal in Africa. Well, some of the indigenous people there in Tanzania are the Maasai people, and they live in dung huts, cow dung and water buffalo dung huts. So the stool of the animal makes the wall of the hut and the floor. They reapply it. So I grew up in Africa in a village where that was exactly what was going on. Yeah. And I would watch them make a slurry of the cow dung and then apply it to the floor, and you would sit on that floor and you would eat with your hands Right. So Paul, the point is it must be loaded with tetanus spores.
Yes.
So sure, delivering babies on the dirt of a Maasai hut, that's the tetanus risk. Not delivering.
And then they don't have sterile scissors to cut the cord.
No, not with modern day delivery. So we just take a tetanus shot, and you and I conclude, in the context of the United States, completely unnecessary.
Correct.
Take diphtheria and pertussis. Now, I'm an adult doctor. Patients do call me for bronchitis and other conditions. I've never tested for these illnesses, Paul, because they're so readily treated with azithromycin. The case counts are so low.
And so rare, right? So rare.
And largely it was going away just with improved hygiene long before the vaccines came in.
Absolutely. Before we run out of time on childhood vaccines, you've been traveling around. There's a lot going on at ACIP. We've got the AAP pulling out of ACIP. We've got the 4 Western states making their own decisions about not following CDC. Give us an update of kind of where are we at? What's going on?
10 years ago, I didn't even know what ACIP was, Paul. I didn't even know what it is. It's the Advisory Committee on Immunization Practices. It largely was a rubber stamp committee for the vaccine companies as they brought a new vaccine on the market. I don't think they ever voted no on anything. And so there are 29 affiliated organizations, including the American Academy of Pediatrics. It's a government committee. It used to be chaired actually by the CDC director. It's no longer chaired, but they're special government employees. They largely are following government rules. And so Robert F. Kennedy essentially fired the old committee, installed a new one, and now they're deliberating, and they've made the tiniest little changes recently in a meeting in Washington, and you can't believe the blowback. So one of the changes they said is just to delay the administration of the first MMR vaccine to age 4. And there were headlines all over the world, Paul, that this was going to take down the vaccine industry.
Right.
Even though the same number of vaccines would be administered, the blowback was incredible. They also recently voted to no more universal COVID-19 shots. And they haven't even addressed other big ticket issues like we've talked about, like vaccination during pregnancy, what have you.
Right.
And so I started
for newborns. They started, but I don't think they finished with that one either.
Right. Yeah. Hepatitis. Yeah, you're right. And so I thought about this, and I had an interview on Capitol Hill, actually at the White House Press Center. And I thought about this, about why would the vaccine industry become so concerned just about a little schedule change? And you know what the reason is?
Well, I think it's all about money.
Well, you know what? I think they're concerned about the confidence in vaccines, or the converse of that, which is vaccine hesitancy. Because immediately I was on Twitter, and I saw some mothers on Twitter and said, wait a minute, my child took the MMR vaccine at 12 months, and it looks like it wasn't safe to do that. Now they pushed it to 4 years. Now every parent who's had their children vaccinated at a year with MMR, they're starting to wonder, whoa, was this a mistake?
Yeah. I think they were talking about the MMRV, that combo vax, because you have double the seizure rate if you take MMR and varicella vaccine together in that MMRV.
Right.
So I think they were saying if you're going to use the MMRV, that one needs to be only used for the booster that's done at 4 years, 4 to 6 years, you give a booster. I don't know that they said not to do MMR at 12 months. I think they just want it to be the MMR alone, not with the varicella component. But you're right.
What percent of MMR vaccination is using the varicella combined now?
I read it was 17% were of 12-month-olds, that 12 to 15-month first dose. Only 17% was actually the MMRV. I think pediatricians are aware of the increased seizure risk, so it kind of doesn't make sense. But nevertheless, that's still 17% are getting double the seizure risk. And we know there's a percentage of those seizures that go on to be lifelong epilepsy and neurological harm. So it makes zero sense to do that.
Right. On top of that, I had chickenpox as a child, but my kids received the chickenpox vaccine. The difference is now my kids didn't get chickenpox, but you know what, Paul? 5 studies show they have a higher rate of shingles now as an adult.
Yep. We traded 50 to 100 deaths a year in the U.S. from chickenpox in 1995 when that vaccine was introduced for way more shingles and shingles deaths. So really, that was a huge mistake.
But you know who just died of shingles, and that was Dianne Feinstein. She had neuroinvasive zoster. Yeah, invaded her brain and killed her.
Did you have any other updates on the childhood schedule with your travels here?
Well, I can just tell you that in Washington, the talk of the town is vaccines. people are becoming increasingly concerned and aware. A recent report in JAMA showed only 40% of parents are going to follow the routine schedule now. I think people are asking appropriate questions. Pediatricians are going to have to face the music.
Yep. I agree. I think the genie is out of the bottle and we can't put it back in. People are now aware that vaccines can and do cause harm. Thank you for your book. This is such an incredible book. I love it. I'm going to have you back so we can talk about COVID, because you are the master of what's happened to us in the last few years. So I want to thank you for being on the show. Your last word to parents, either for pregnancy or early childhood on vaccines, what would you tell your kids now?
I tell the children, as far as we can tell, a healthy child born today is healthier if they stay free of vaccines. If vaccines are going to be given as single injections and later in life, it's far safer. And then look to CHD and Dr. Thomas for updates. Support CHD. This is the fall time. It's time for donations. CHD is a philanthropic organization. It's the only organization here that seems to be on the side of parents advocating for truth.
Thank you for that. childrenshealthdefense.org. Folks, this is a true labor of love for this organization. They are standing in the gap for our children. Thank you, Dr. McCullough, for being on the show. I'm going to have you back soon. I'm grateful for everything you've shared today. Folks, you can also find me. I do some coaching on this. I'm no longer licensed, so I don't diagnose or treat, but I can educate and coach at kidsfirstforever.com. I look forward to seeing you next week.
Okay, we are live. Tell everyone your name, please.
I'm Dr. Denise Sibley in Johnson City.
And what kind of a doctor are you?
I'm an internal medicine physician for 35 years.
35 years, so you know what you're talking about.
Yes.
All right, let's start first of all with the area that we're in. We've already heard from some doctors in this area, and amazing pharmacists as well on ivermectin. Talk about what happened, what you saw. Was it chaos? Did you stay calm yourself? Were you concerned about the whole COVID thing? Talk us through that whole
So COVID hit here around March of 2020. I had been watching it come through Italy, Lombardo, Italy, and then through France because I have a daughter there, and coming through New York. And so I was keeping up with the data, and by the time we got it, it looked like it had the mortality rate of the flu, the seasonal flu. So I was keeping tabs on it long before I think other people were, because of my daughter being international. And then when the first people called me for COVID treatment, I did what they did in 2003 with SARS-CoV-1, which was to use hydroxychloroquine, which is a drug that's older than me. I'm 63. And so it's safe. I've written hundreds and hundreds of prescriptions for people that go on mission trips for malaria, also for connective tissue diseases like rheumatoid arthritis, all that stuff. So I was very familiar with the drug, and I called it in to a Walgreens and then a Walmart, and for 10 tablets, neither of them would fill it. And I've never been turned down to have a medication filled, and it was about $10 for those tablets. And I just got off the phone. I was like, what happened? What just happened? And the pharmacist said, well, because you're writing it for 10, I know that you're using it for COVID. And I was shocked, because I've written 180 at a time for a 3-month supply for someone who has rheumatoid arthritis. And I do it all the time. And so I immediately knew something was up, that something wasn't right, and it began my deep dive. So there were further deceptions, articles that were fake in journals, things that didn't make sense. Masks we knew didn't work in 2017. We knew they didn't work for respiratory illnesses. Everything seemed upside down, and the hospitals were acting strange. So my deep dive, I started getting calls. I didn't advertise, but word got around that I was treating, and I eventually treated with ivermectin. I used the multi-drug sequential therapy that many of the doctors were using. We developed a collaboration among all of us in the United States and internationally, and I was asked to join an email group with Peter McCullough, so we were constantly collaborating on what worked and what didn't. Then we developed a local physician group, and we met as well to decide what to do with these people, how to help them. And so literally I was inundated with people for treatment. And when the first calls came, I heard God say that I was going to do this for His glory, and I was not going to take any payment. And that was part, and I didn't really understand it at the time, but obviously people were in need, but it became my platform that why am I killing myself talking until 11:30 at night to patients? I'm not getting compensated. Why am I doing this? You can't say that I have a financial incentive. And to this day, it's almost 4 years later, I have no financial incentive. I've treated thousands of patients. I've treated long COVID, vaccine injuries. I've treated everywhere and anyone that would call me. And for that, and then I got into the legislative process. Some of the representatives and senators reached out to me for legislation, and one of the big things that was accomplished was that we got ivermectin available without a prescription in Tennessee. We're the only state. And so I made lots of trips to Nashville and gave expert testimony in the House and the Senate on various bills, natural immunity and ivermectin and no patient left alone, different ones. But the ivermectin was just a huge thing because I wanted people to have safe pharmaceutical grade access to ivermectin. And it's a very safe drug. It's probably the safest drug. It won a Nobel Prize in 2015. It's a natural product found in an organism produces it in a golf course of Japan. So it was a very safe drug. And right after that bill was signed into law by the governor of Tennessee, 2 weeks later, I received a certified letter by my American Board of Internal Medicine. That's the body that certifies me that I'm an internal medicine specialist. And they said that they were sanctioning me and going to withdraw my certification, which I've had untarnished, perfect record since 1989 because I was a misinformation spreader. And so that began a 1.5 year long legal battle, which finally concluded 3 months ago today in a personal hearing, an appeal hearing before the American Board of Internal Medicine in Philadelphia. So $50,000 later, I'm still defending myself for treating patients for free and using FDA approved drugs and nutraceuticals or vitamins. Now, after my long presentation, I took 13 3-inch binders full to the American Board of Internal Medicine appeal hearing, and I laid them all out on the table with all of the 3,500 peer-reviewed studies about vaccine injury, harm, mask efficacy, vaccine efficacy, and I laid those all out for them to show them that I was not just a little town doctor, but I actually had read all the academic literature and I knew what I was talking about. And so I talked nonstop for hours. And it's 3 months today, and I've not heard from them, so they have not pulled my board certification. They also have not gone after the other folks who were lined up after me, who are much more astute than me, because they were also going to be sanctioned and their board certification taken away. And so it's been a ride, along with that, trying to treat people as they've now, mainly it's vaccine injuries, which are much more difficult to treat than the illness itself. So I wear many hats in the community. I feel responsible for my region. I feel responsible for Tennessee. We have a lot of legislation going this session to try to stop the shots, various other things. But I feel like God has used me in a way that I never knew was possible. and it's made me the busiest I've ever been with his strength.
I am hearing from people already, we haven't been here for very many hours, but people are saying you've saved so many people's lives. So you're an amazing, amazing doctor, human being.
Well, I give God the glory, and people that helped put these protocols together, and it really was a new way of medicine, because in the days before, if somebody was really, really sick, you told them to go to the ER when they weren't breathing well. But now the ER was the last place you wanted them to be, and no one wanted to go. So I was managing acutely ill people at their home, going to their home, doing whatever I needed to do to treat them. So it was a new experience for me. It stretched me. But even, in your 60s, you can learn new things.
So I need to ask you, Dr. Sibley, about the great many reports we're getting as people sit here and talk about their loved ones. And you can see in here, this is a memorial of a great many that lost their lives. They said they were killed, their loved ones were killed in hospital. Well, not just on remdesivir, they're put on vents, fentanyl death. What's going on?
Well, one person in particular, and his wife could not be here, but in February of 2021, I got a call that this man was in the ICU, and he said, "I've heard that you can get me remdesivir, and I'm sick. I think I'm dying." He was in the ICU. And so I worked for 3 days nonstop, and I mean literally nonstop, day and night, trying to find a lawyer to get a court order to order them to give him ivermectin. That's what he wanted.
Not remdesivir.
Not remdesivir. He did get some remdesivir, but he wanted ivermectin because he thought he was dying. And so all the lawyers had conflicts of interest with our monopoly healthcare, and the eighth one finally said, "Okay, I'll help you." I got all the scientific evidence together. The two legal teams met with the hospital, and my lawyer just tucked tail and went away. So there was nothing. They would not let us allow his wife to bring in ivermectin. They have ivermectin in their pharmacy, but they would not allow it to be given. They wouldn't allow anyone to bring it to him, and he was getting worse. And his wife asked me that his pastor had not come to see him because he had COVID. And being a Christian, would I anoint him with oil? So I went in as a person, a fellow Christian, to anoint him with oil, and you would think that I was doing something terrible. They had their eyes on me the whole time. I was reprimanded by the facility for doing that, and that man passed away. And to this day, as you can tell, there are many cases like that where people passed away. They passed away with vaccine injuries as well. And the hospitals here in Tennessee made $150,000 above what their insurance paid for their illness. If they got remdesivir, intubated, died, that's what they were making extra. So there was money to be made. There's still, even to this day, there's someone in the hospital right now that I know who had COVID 4 weeks ago, but they still want to give him remdesivir. And I mean, it's not stopped. You'd think by this time it would have, things would have changed, but these were real people. And for them to let that man die, it affected me very much. And so this really happened, and they really did intentionally let people die, or worse.
I'm trying to understand how doctors, you're a doctor, how your colleagues, your doctors, how could they allow it? They must have known. Why did they go along with it? Why did they treat? We hear so many people being told that they were abused so badly. These are human beings treating human beings. What is this?
It's like a switch turned in their head. They worked for the monopoly. They worked for groups who would fire them, and it was well known that if you gave ivermectin, you were immediately fired. So if you didn't follow the approved protocol, you'd be fired. And so many of them were afraid. During the vaccination period, I think it's 95% of doctors participated in the vaccination. So you're not going to speak against something that you've actually participated in, and you'll get fired. And you'll be ridiculed, and you'll possibly lose your certification or your, whatever you've worked all these years to obtain. I think there was you can call it cognitive dissonance, you can call it willful blindness. They could not think clearly, and I don't know morally how they laid their head on the pillow at night. I don't know. I can't speak to that.
A couple more questions, if you don't mind. RSV, they're really going for the babies at the moment. They've already started venting the babies and killing them because they didn't get the RSV shot. Similar pattern we're seeing already. What's your advice as a doctor? We're not giving medical advice out here for anybody listening. What would be your advice for RSV if, what would you have in your cabinet? Let's put it this way. What would you have in your home for RSV? When I was brought up, you had those kind of things. You want a steamy shower, a steamy thing.
Right.
What do you think?
So,
I don't want young mothers rushing to hospital.
Correct. And RSV has been around as long as I've been a doctor. That's not new. I'm not a pediatrician, but I had children myself. And I would use steamy showers. I would use nebulized treatments. I would give them vitamin C, lots of vitamin C. I would give them vitamin D. This is not a disease that's been a deadly disease. The monoclonal therapy that they are advocating for children, for newborns really, to be given, during the trial, 12 babies died in the treated arm. And they said it was unrelated to the monoclonal therapy. But, they can make the study say whatever they want. 12 babies died. And so I am not in favor of the monoclonal treatment for children. I'm not in favor of rushing your child to the hospital. Find a good independent pediatrician or family practitioner who will work with you on nutraceuticals and things that you can do at home, and have those things in your home for when you are sick. I think every family, every house needs to have a nebulizer.
So the other side are getting terribly excited because disease X is coming. They're already making a vaccine for disease X. How would you recommend treating disease X?
Well, we don't know what disease X is. It's kind of a placeholder. It's fear. It could be fear porn. My personal thoughts is that after the pandemic treaty and the International Health Regulation Amendments go into effect in May, that disease X will become a thing, whatever it is. But I would recommend vitamin C, D, zinc, NAC. Again, having your nebulizer there that you can nebulize even saline. But there are ways to treat, and I recommend that every household have ivermectin because it treats all RNA viruses such as influenza and RSV, and COVID. So you should have, especially in Tennessee, there's no reason why every household shouldn't have ivermectin because you can walk in at selected pharmacies and get it.
Thank you for being an amazing person, brilliant doctor, and being strong and trusting to tell the truth. We really appreciate it. If everybody did that, this would be over.
It would have been over. 85% of the people that died of COVID would have been saved. We would have been over if early treatment would have been incorporated. But they actively suppressed it.
But not just that. Brave doctors like you speaking truth. That's what going to make this over.
It's a God thing.
It's a God thing.
It's a God thing.
Amen to that.
Mm-hmm.
Thank you.